Welcome back to Midday Kentucky, everyone. We're learning the definition of health and what makes chiropractic care different from other forms of health care. Here to tell us is Dr. Sean Twitt from Cornerstone Chiropractic and Wellness. Welcome to the show, my friend.
Thanks for having me.
Okay, very simple question to begin with. What is the definition of health?
Well, most people think health is defined based on how they look or how they feel. Okay. But according to the World Health Organization, the definition of health is the optimal function of your body, both emotionally, physically, socially, spiritually, and not merely the absence of disease.
Okay, so it's quite broad.
Yes.
What you feel?
I agree with that because only 10% of the nerves in the body are pain sensitive. So if you wait until pain shows up, the problem is probably been there for a while.
It's already been there for a while. That's what they say about cancer and things
Exactly.
like that. If you wait till you are sick,
It's too late.
it's, which is scary,
It is.
Prevention is key.
It's huge.
Prevention is key. All right, what makes chiropractic care different than other forms of a health care?
The biggest one is that we are a non-drug healthcare provider, okay? We don't chase after symptoms, we address the cause. Now, the United States is about 5 to 6% of the world's population, yet we use about 70% of the world's prescription medications. And the only two countries in the world that allow drug commercials, for example, on TV are New Zealand and the United States. It's illegal everywhere else.
I was going to say that.
Yeah. So in this country, we go to the doctor instead of saying, well, doc, should I be taking a drug? We go to the doctor and say, which drug should I take? It's the wrong question.
Oh, because I see all the drugs that are advertised here on TV, and they have like 50 warnings afterward. That's half the commercial.
Right.
Agree?
Yeah, some of the drugs are worse than the symptom that the drug is designed to address. And some of the depression medication actually causes depression, suicidal thoughts, thoughts of aggression. It's just kind of asinine. It kind of blows my mind, actually.
Do you, well, I want to ask you a question that's not with our list just yet, but because you have that thought pattern, you do believe in traditional medicine.
Yeah.
Because there is a need for it.
Yeah, I mean, if I have my arm cut off in a car accident, I'm not going to the chiropractor. I'm going to the emergency room.
No,
right?
I don't think so, my friend.
So, I mean, for emergency care, we have the best doctors, best technology, best medication in the world, bar none, okay? Crisis care, management, okay? But for health, for true health and wellness,
And that's different.
that's totally different.
Yeah, I got you. All right, what is Thomas Edison's take on healthcare?
Well, Thomas Edison was the inventor of the light bulb, and he said the doctor of the future will give no medicine, but will interest his patients in the care of the human frame and in cause and diet and prevention of disease.
Got you. All right.
He sounded like a chiropractor.
He does, doesn't he? Maybe
Smart man.
Maybe, well, you're smart. Maybe you should invent something else like the light bulb. Okay. Now I'm gonna mess this up. What's my next question? What did
Hippocrates.
Hippocrates say about health?
Hippocrates was
What
the
is
father
that?
of
Yeah.
medicine, and
Okay.
2,400 years ago, he said, look well to the spine for the cause of disease.
He did?
He did. So how far off the beaten path have we gotten?
I think a lot.
Very far.
Because I have friends that think they don't need to go to the chiropractor, or they've never been to the chiropractor. I know when I go and get, is it
Adjusted.
manipulated or adjusted? Is that the word?
Yes.
I do feel better. I feel like my blood's pumping through the body.
Well, your central nervous system is functioning better. Your body operates like a well-oiled machine that much more effectively when your spine is in line.
Yeah.
Your central nervous system just functions a lot more
I got you. One more question. What are the most common reasons people seek out a chiropractor?
Well, number one is usually hip pain and back pain.
Yeah.
Number two is headaches and neck issues. But what I'm finding is that I'm starting to hear younger and younger people more and more often coming in despite not having any symptoms because they just want to get their spine checked. So they're becoming a little bit more proactive in general, and that's nice.
We've only got 20 seconds left. Tell people how you do your billing, because you don't do healthcare.
Yeah, I have very low overhead,
Yeah.
and so I don't take insurance. I don't answer to the insurance company, I answer to you. And so my rates are very affordable.
This is what I want everyone to know. You can afford to go to the chiropractor. You don't need to have the health insurance. If you want to find out more information about Cornerstone Chiropractic Wellness, it's really a great system over there, guys. Give them a buzz on their website as well and Facebook. We appreciate you coming in.
Thank you, sir.
Okay.